I am Dr. Dhruvil Pandya, short for Dr. Dhru Pandya. I'm a neuroendovascular surgeon. I'm a neurointensivist, and I'm a stroke neurologist. I did my medical school out in Caribbean. So it's called Ross University. I did my residency. I did internal medicine and neurology residency, which is 5 years in Medical College of Wisconsin in Milwaukee. And then I did a fellowship following that involved neurointensive and neuroendovascular surgery. What I deal with is neuroemergencies, problem with vessels involving the brain and neuroemergencies. I deal with things like strokes, things like brain hemorrhages, subarachnoid hemorrhages, blockage of the blood vessels. I can manage patients while they're in the ICU when they come with these neuroemergencies, or I can perform minimum invasive procedures on them. For example, patient with a stroke who has blockage of their blood vessels, I can go in reasonable time and try to remove the clot from the body. I can see patients in my clinic who have problem with their blood vessels, who has diagnosis of cerebral aneurysms, diagnosis of carotid stenosis, diagnosis of AV malformations, AV fistulas, complicated stroke patients who needs kind of the expert touch or more looked into why they're having strokes. Those are kind of the main patients that I see in the clinic and in the hospital. The field I'm in, we're always learning. We always have to keep up with the new literature, always have to read, always have to keep up with the new technology and new skills. There's many ways we can keep in touch with this. We are constantly carrying new journals on a weekly or monthly basis that's kind of keeping us up to date on all the newer technology, newer evidence. We are also constantly going to courses. If there is a new catheter out there, if there is a new stent out there, we are going to these teaching courses where they're training us how to use these catheters. And this is almost every month, every other month, we are constantly doing these things to make sure that we are up to date with evidence, up to date with technology, and up to date with our hand skills. We are a group of individual physicians who are going to be starting a neuroscience program through the Presence Health System, where we're going to have two hub hospitals, a Resurrection and St. Joseph and Joliet, and we are trained to manage patients with complicated neurological issues, neurological emergencies, as good as any other university hospitals in the community. One of my goals in this community is to create a stroke awareness for the community and for patients to recognize symptoms of strokes so they can get to an appropriate facility on time to get the appropriate treatment. As a physician, and all the trainings I've done, it's important to understand individual goals. I don't think we as a physician should be treating a disease, but we should be treating patient as a whole. And I think my training is kind of gives example of that. I'm trained to be internal medicine, neurology, neurointensivist, neuroendovascular, because I want to take care of the patient as a whole. Okay, I want to understand each patient's needs, each patient's requirements, and try to focus my treatment toward that, instead of focusing on an individual disease.